Once again, welcome everybody. This to the Gwen Youth Hub's webinar titled Engaging the Community to Support Health and Care Workers. So just a side note before we begin, this webinar is being recorded and the recording will be uploaded afterwards to YouTube, to the Youth Hub's YouTube channel. So more people can afterwards also see this wonderful panel discussion. So the COVID pandemic has had a severe impact on health systems, on health services. Millions of people have lost their lives, but health workers are witnessing high burnout rates and in several places also violence. Now, in the year of the health and care workers, communities should work together to address these needs of their health systems and of their healthcare providers. Only by coming back and building back better together can we emerge from this situation as winners and look into building the future together better. So this webinar, as you have already understood, is focused on gaining the insights and getting various opinions from speakers coming from very different backgrounds. So today we have with us Ms. Stuti Chakraborty, who is a young health worker in rehabilitative medicine from India. We have Estefania Malasisi and Pilar Arosagaray, who are patient representatives from a diabetes NGO in Argentina. And we have Karl Gierstoffe, a documentary filmmaker from Germany. So the session formats that we are following will go as follows. Firstly, the speakers will introduce themselves, and then we will move on to a moderated panel discussion, followed by a Q&A. So as you all see in the bottom of your Zoom screen, there is a Q&A button. Please feel free to write any questions you have to the speakers into that section. And after the discussion has finished, then we will be picking up questions from the Q&A section. All right, so without further ado, I would hand it over to Stuti for a brief introduction. Stuti, please.
Hello, everyone. Good evening, good morning, depending on whichever part of the world you're joining from. My name is Stuti Chakraborty, and I'm currently working as an occupational therapist, as a neurorehabilitational professional at Christian Medical College, Vellore, in the southern part of India. And I'm very interested in neurodisability and understanding the impact of different conditions, especially neurological conditions, on the lives of people living with disabilities. And I work on a daily basis with people living with chronic disabilities, and I'm involved in the rehabilitation management and intervention of these people. And apart from that, I'm also a very passionate advocate for people with disabilities, for mental health, menstrual health equity, and gender equality. Thank you so much, and I'm really happy to be on this panel today.
Thank you, Stuti. Estefania and Pilar, please.
Well, hi, my name is Estefania Malasisi. I am from Buenos Aires, Argentina. I am 26 years old. I was diagnosed with type 1 diabetes at the age of 2. I am a medical student and I want to specialize in pediatrics and diabetes, obviously. I am a young leader of the Association for the Care in Argentina, for the Diabetes Care in Argentina, Cuidar, since 2010. I am mentor and young leader of the International Diabetes Federation Young Leaders Program since 2015 and 2017. And I am member of the Blue Circle Voices, also from the IDF. And I am member of the steering committee of youth representative of the United Nations Department of Global Communication since last year. So, well, thank you so much for this invitation.
Well, hello everyone. Very nice to meet you and very nice to be here with all of you. My name is Pilar Arosagaray, and I'm also from Buenos Aires, Argentina. I was diagnosed with type 1 diabetes when I was 12 years old. I'm now 29 years old. In 2016, I had the opportunity to make the Young Leaders in Diabetes program from Cuidar, this NGO that Estefania mentioned. That is an NGO that we work for children, youth, and adults living with diabetes since 2001, and we advocate for all these people. So, well, with the years, I became a patient advocate, and I managed the institutional communications of Cuidar. And since this year, I'm also a member of the Youth Representatives Steering Committee of the Department of Global Communication of the United Nations. So thank you very much for this space.
Thank you, Pilar. Carl, please.
Yeah, I'm Karl Gierstoffer. I'm a documentary filmmaker from Germany. I live in Berlin, and I spent like 3 months between December and March at Corona intensive care ward at Charité in Berlin. Charité is Europe's biggest university clinic. And I filmed and directed a 4-part series, which was a huge, well, if you can say so, success in Germany. 2 million people have seen it. Almost 5 million people have seen the various different stories I put out there. It was a very intense time because these patients were really the sickest COVID patients. Most of them were on ECMO therapies, so their lungs were being replaced. A lot of people died, unfortunately, in late December, early January. And since I spent so much time there, I was able to get a very intimate look into this aspect of the COVID pandemic and reached a huge audience. Before, I spent also 3 months, 2014, in Liberia during the Ebola outbreak, and I directed a documentary there. In rural Liberia, I did documentaries on HIV in the DRC. So I'm a biologist by training. I have a certain perspective onto the world, and this is how I find my topics, but not exclusively. But this is mainly what I do.
Thank you, Carl. A warm welcome to all of you. So let's begin then. Stuti, you are a young health worker specialized in rehabilitative medicine from India, a country that is very highly populated and also struggling, unfortunately, severely with managing the pandemic. The ongoing COVID pandemic has had an impact on the provision of essential healthcare services, including rehabilitative health services and occupational health. While health systems around the world are being challenged by the increasing demand of care of COVID-19 patients, preventive and curative services, especially for the most vulnerable populations, such as children or the elderly, people living with chronic conditions, minorities, and people living with disabilities, are facing severe impacts. So working as a rehabilitation professional, you definitely have some insight to the challenges and opportunities you witnessed while providing care to patients. Could you talk a little bit about how your everyday work changed when the pandemic hit India? How is it currently? And perhaps mention also some overarching challenges people working in the health and care sector are facing currently. Please, Tuti.
Thank you so much for the question, Nawe. I think that's a very important aspect to shed light on, and I hopefully can do some justice to talk to our attendees today about this. So to just give a sort of overarching insight into what I do. So I work with children, adults, elderly people, people of different age groups and communities, because as you might be aware, India is a very diverse country. So people from different parts of the country, as well as even different parts of Asia and the rest of the world, come to the tertiary care hospital that I work in, because it's one of the largest tertiary care hospitals and multi-speciality hospitals in India. So we have a lot of different critical people and patients coming to us. So the work as it is quite challenging. But on top of the COVID-19 pandemic, since the time it started, there has been a lot of research to suggest that it has definitely had an impact on chronic care services and also impacted people living with a chronic disability or a disability in general. So for people, from the perspective of a person with disabilities and someone who works with them on a day-to-day basis, I can assure you that it has definitely disrupted their lifestyle to a lot of extent, mainly because people living with chronic disabilities also tend to have various different other types of associated comorbidities. They might have diabetes, hypertension, they might have breathing related difficulties. For example, patients living with spinal cord injury have difficulty with their lung functioning and lung capacity, and have difficulty with breathing. They also have different other systems of the body compromised, for example, the nervous system, the musculoskeletal system, their vision, their hearing. A lot of things can be impaired, specifically when the brain is also damaged. And a lot of them are also immunocompromised as well. So definitely when the pandemic started, there was an extreme amount of fear lurking in the minds of people living with disabilities. A lot of them living alone, or people who were not dependent but actually led an independent lifestyle, had to go back to being dependent on somebody else because they were not able to move about, and they had to go back to leading a dependent lifestyle, even though they were independent, mainly because of the halt in the provision of services that enable them to lead their lifestyle independently. So that had been like one major disadvantage. As far as I have seen, and with my experience working with people with disabilities and all the patients that I rehabilitated that had gone back into the community. And so once the pandemic started, there was a lockdown, of course, that was stringently imposed in India. And since it's very populated, it was definitely difficult to control people and raise awareness about the importance of following safety protocol in different parts of the country, and it still remains a challenge for sure. However, there were support systems in place, but at the same time, this had a major impact on the lifestyle of people with disabilities. If I could classify it into three major ways, it would be, the first would be the disruption of routine rehabilitation services. So people who were already admitted to our inpatient rehabilitation setting had to go back home abruptly, and this disrupted their rehabilitation treatment process. And so what happens is, a lot of them were people who had just had an acute injury to them, or had an acute illness that had started to them. And it's usually normally said that rehabilitation works best for most chronic conditions like stroke, or cerebral vascular accident, or spinal cord injury, or an amputation wherein you have to remove a limb. Rehabilitation services work really well when the disease has, or the disease or the injury or the illness is still in the acute or subacute stage. Once it reaches the chronic phase, rehabilitation, the efficacy or the prognosis of rehabilitation and what you can expect to improve with rehabilitation reduces. So since 1 or 1.5 years, most of the people with disabilities have been locked up inside their homes without proper access to rehabilitation services. So that has led to a lot of people sort of transitioning from their acute or subacute phase to their chronic phase of the disability. And so it has impacted their outcomes and their prognosis. And that has in return increased the burden of disability in the country, as well as I'm sure the scenario has been seen in different parts of the world as well. Secondly, it has affected for people those who live an independent lifestyle already, and those who have been rehabilitated back into the community, it has impacted their follow-up treatment. So a lot of people with disability, most people with disability, need to come back to the hospital for regular checkups, for follow-ups, for routine tests and things like x-rays and blood profiles that have to be done on them routinely on a 3-month, bi-monthly or 3-monthly basis, or even a quarterly basis. And so that was completely disrupted once the lockdown started. A lot of the people with disabilities were definitely afraid to step out of their house. They did not have access. Some of them even had lost access to their medications and routine health care services. Because in the community, like in India, there are a lot of community health workers that go from door to door and deploy essential services. And all of those things were impacted because of this. I think the third thing that comes to my mind most majorly is COVID-related disability, I would say, as a lot of evidence has shown that COVID is known to cause neurological dysfunction, for example, conditions like Guillain-Barré syndrome or even stroke or thromboembolism. Because it is a viral attack, it can have an impact on different parts of the body, and it has been evidenced to impact the nervous system specifically. And so it has led to a lot of people that have come to us. Even now in the outpatient departments, we have a lot of people that come to us with post-COVID fatigue, weakness, post-COVID neuropsychiatric conditions, post-COVID neurological disabilities. And so that I feel COVID in itself, the pandemic in itself, the virus in itself has had an impact on the numbers or on people to increase disability. So I think these are the three ways that I would classify and how our day-to-day services have been impacted. And speaking from a healthcare provider's view, it has definitely been very difficult managing patients, because once the lockdown was lifted, there was completely an overflow of people coming back to us that had been affected by the pandemic. And so even when the pandemic initially started, we were all kind of grappling with it. We were coming to terms with how to manage it. So since therapy is very close contact based, you need to have a lot of hands-on contact with patients. We had a lot of fear as therapists and as neurorehabilitation professionals as well, in terms of providing care to our patients or our clients, because we did not want to transmit the disease or the illness to them. And so, following regular schedules and timetables and routines, as well as maintaining social distancing or physical distancing in therapy areas, which tend to get very crowded, especially in a country like India. And in the very large tertiary care setup that I work in. So those challenges were definitely very pertinent initially. However, as time went by, we kind of got the hang of it. We got the hang of how to manage our patients. We learned safety protocols and precautionary measures. We learned how to discuss about this particular condition with our patients living with chronic illnesses and chronic disability, and telling them and educating them about the safety protocols. So with time, things have gotten better. And then the second wave came in, and it kind of disrupted everything all over again. However, the second wave now has started subsiding. And so it has been a lot of ups and downs over the past 1.5 to 2 years. But yes, I would like to end with saying that we have been resilient as a healthcare workforce and as a young health worker. We have all faced a lot of challenges, but I think that at the end of the day, it has definitely made us a lot more mindful of how important health and life is. And I think with the community support as well, we can take this forward. Thank you.
Thank you, Stuti, very much for providing such a thorough background of the situation from both perspectives, actually, from the perspective of patients and from the perspective of being a young health worker in such a situation. So it would be good now to discuss a little bit about how is the pandemic, how was the pandemic from a patient's perspective. So perhaps, Estefania, you are from Argentina, you're living with diabetes, and you're also working closely with other people in the community who have diabetes. Can you talk a little bit about how was the situation in Argentina regarding diabetic and chronically diseased patients when the pandemic started? Perhaps you could talk a bit about some measures that health providers picked up when taking care of patients with chronic diseases.
Yes, well, let me give you some background about Argentina. Here, I mean, Argentina has no data, but it's estimated, according to the WHO, that more than 4.4 million of people is living with diabetes in our country. But the thing is that half of them don't know it. In Argentina, on the other hand, we have a national diabetes law that makes all health insurance companies to cover the 100% of medicines and supplies for all people living with diabetes, if they have type 1 or type 2. However, this law is not always enforced. On the other hand, Argentina has a highly fragmented health system in which 3 health systems coexist. I mean, we have the public system, which is the system for people who are treated in hospitals. Generally, they are the most vulnerable. Then we have the social security system, which is the system accessed by people who work as employees. And finally, the private health system, which is a system for people who pay for this service. With the outbreak of the COVID-19, our government has taken measures so that visits to doctor or purchase of medicines are made online. So that was that has greatly helped the family, no? However, we were aware of families that have problems with the access and queries to Cuidar on this and many other topics that have increased exponentially. Many families claims their health insurance about they didn't have access to this medicine. No, I mean insulins or test strips. So this was like the biggest problem we had to face during this pandemic. From Cuidar, we have contacted government authorities to find solutions, but we noted that they too are adjusting to this situation. And what worried us the most was the lack of flexibility and speed of response, particularly when it came to such a sensitive issue as the lack of supplies and medication. I mean, if we don't have access to insulin, we die. So for this reason, we conducted a consultation for patients on access to medication to find out what the real situation it was regarding the lack of delivery of supplies and insulin. And the information collected was used to carry out a survey, and we could help make claims before the different health coverage responsible from complaining with the diabetes law and before the control bodies to try to resolve the situation. What we can certainly say is that many situations that have always existed and have never been taken into account in relation to people with diabetes in our country, but the pandemic not only makes them visible, but also exposes and increases of these kind of problems. We hope that this crisis at least serves to generate changes that improve the lives of people with diabetes in the near future. And in relation to the measures that were put in place by health professionals to maintain the care of people with NCDs, the use of telemedicine was introduced with a virtual consultation. But despite this decision, in Argentina, there are also many problems to access to connectivity. So many people were left without medical care. On the other hand, although health professionals often continue to provide face-to-face care, but people, for fear of contagion, opted not to go to the doctor's office. So treatment was interrupted in any way. I mean, we have the virtual option, we have the face-to-face option, but the treatment was interrupted in many cases, and that's it. It's a big problem and will be a big problem to the future.
Thank you, Estefania. Very interesting insights regarding how, for some, the digital options also worked, and for some not, and also how in Argentina actually the government worked hard on finding different solutions. So perhaps we can move now a bit and change the region again. So Carl, you mentioned previously that you did a documentary about COVID-19 and specifically how was the situation in the ICU in Charité, Berlin. Could you talk a little bit about this project and the previous projects as well in greater detail? Perhaps who are these movies targeted towards and what role do you believe they play in understanding better the health emergency situations such as COVID or Ebola are and were?
Yeah, I came to the project for several reasons. It was a technical aspect as well because I got access to a Corona ICU, one of several which were at Charité campus in Berlin. And I got total unrestricted access. So I spent literally 3 months every day there, 12, 14, 16 hours. And it was just me. I had quite a compact camera setup and sound setup because I couldn't work with a sound technician or a bigger crew. Now I can shoot myself, I can direct myself, I can work on my own. So this was one reason why my producer approached me with that project. And also I spent 3 months in Liberia in 2014, late summer, when the Ebola epidemic there moved from Monrovia into the countryside. And it was the same, it was an Ebola treatment center where I had access and where I embedded. So this is how I approach my topics, because I want to, as a documentary filmmaker, I want to dive in a little bit deeper than normally the news crews do. In Liberia, it was very important because also like organizations like Médecins Sans Frontières never said that they were doing all the work. Quite the opposite. They said, look, we have to look at the Liberians. They are doing the bulk of the work. But still, you know, the international reporting was a little bit like, well, the West is coming to the rescue of the poor Africans sort of story. And of course, on the ground, it was a totally different story because most of the work, beginning from the contact tracing, beginning to the care of the patients and so on, was done by the people on the ground. And then the longer you're there, you establish relationships. You gain the trust of the people, and you find stories which I think transcend the usual news stories, but also shed a light on a lot of aspects of our existence. And I found that in Liberia, because I portrayed a story that developed over 3 months of a father who took his son prematurely out of quarantine. And because of that wrong decision, the son infected the whole family, and his father lost his wife and 4 children. And in his village also, I think 16 people died. So it was a very dramatic thing that evolved and developed. But it also showed that there was a huge capacity for anger, and for looking for someone to blame. But at the end of the day, also for forgiveness. So it was really at the core, it was a story about guilt and forgiveness. And I found that very powerful, and that movie was very successful in Germany, and it won an important award. And so I was asked whether I would like to go to this ICU, Corona ICU, and film there. And I had unrestricted access, and my producers and my co-director, she worked really, really hard to establish that unrestricted access. And I started to film just before Christmas 2020, when the second wave was really hitting Germany, when the cases were going up steeply. And I didn't know what to expect. So I think nobody really, we had these images from the UK, we had some images here as well, but I wasn't really prepared for what happened there. And I think even the doctors and nurses weren't really prepared for what happened, because there was such a massive influx of patients. And what you need to understand is this ICU was or is specialized in organ replacement therapies. They always did dialysis and so on. So they had a lot of experience in ECMO therapy. And so they got relatively young patients, very, very sick patients, and a lot of them died. So of the 14 COVID beds, I think around 40 people died in the first 2-3 weeks. So it was an extreme situation for the doctors, the nurses, the patients who were there and who were awake, and also the relatives. And for me, it was very emotional as well, but I spent so much time there that I could develop very, very intimate relationships with everybody. And I just followed that through over 3 months, and it was broadcast on ARD, so on national television in Germany. It was hosted on their online site, and I think I never did such a. It was quite brutal, because it was very. It's without narration, and I really just showed what happened there. And I think the public wasn't prepared for it. because I think the public, by and large, didn't understand that the COVID, really severe COVID cases can have so many different symptoms that it can destroy your organs. It first destroys your lungs, but then subsequently you get a lot of systemic problems. People die of sepsis at the end of the day. So it's a really, really severe disease and sickness that not only get the old people. And in Germany, I think that people thought that if you get artificial respiration, then it's already the worst. But in these ICUs, it was just the beginning. But then I think there were great moments of absolute human tenderness and care and warmth, and in a way life there was reduced to the mere essentials. It's like, who will live, who will die, who will be there in your last hours, who is caring for you. And I think everyone understood that the doctors and nurses and everybody there really gave their, not only physically their last, but also emotionally, because they were there for the patients, because often visitors were restricted to visit their relatives. So it was psychologically a very, very difficult situation. And therefore, I think that 4-part series became very emotionally intense as well. And I think it captured people, and we got a lot of feedback, and I gave a lot of interviews in Germany, and a lot of people said, I mean, from everyone, even doctors who worked there said that their relatives for the first time understand what they were doing. Nurses who worked there said, my father now knows what I'm doing. I'm not just washing patients. I'm really like, it's extremely demanding technical work. And also for the patients, because the patients nobody would believe in what kind of in-between world between life and death they move. So in that sense, I think it reached a lot of people, and it didn't really change the perception. I think it more or less opened up a window into a world which was very essential in that pandemic, that the people didn't see like that. And for me as a filmmaker, it was crucial to spend so much time there, 3 months, because otherwise it would have been just superficial. Yeah.
Thank you, Carl. It's very interesting to see, let's say, as an outsider, you lived there, you lived the lives, shadowing the health workers who took care of the patients. So it is very interesting to also see how this thought process of seeing the patients being supported, but also the health workers needing support, being often strained both physically and mentally, but still in the end managing very, very well with their lives there, the lives of their cared ones. So with this, we have provided, let's say, a background or an overview of how, from different perspectives, the pandemic looked like for different people, for different specialists and counterparts across the world. So there is now moving into the parts of engaging the communities in supporting more health and care workers. I believe one important area that often is less thought of is actually the importance of research as well in supporting the pandemic and supporting co-colleagues and building the knowledge base, the collective knowledge base across. Stuti, you mentioned that you have started becoming more active when it comes to research these past years, and especially during the pandemic. Could you talk a little bit about your motivation, and also how do you feel in general? Are young health workers currently doing enough research about the pandemic and in general? And by that, could they support more fellow colleagues? Could things be better when we talk about this knowledge base and research being done?
Yeah, so I think research is definitely an extremely imperative aspect. So for me personally, research is something that I'm really passionate about. But having said that, I do feel that young healthcare workers are not being adequately engaged in contributing to research, mainly because, especially in terms of, like, let's say India, I would say that ever since the second wave has started, most of the frontline work has been on the shoulders of young healthcare workers, recent interns, recent graduate doctors, and nurses and other healthcare professionals that have just completed with their undergraduate studies or are currently pursuing a super specialty or a specialty stream in medical or healthcare profession. And so there has been a lack of time and also a lack of resources for these healthcare workers to contribute to research. However, it's extremely imperative and crucial that they are integrated into research work and that research is translated to the community effectively. So a lot of my work is, since I haven't been on the front lines continuously throughout the pandemic, I have had time to also take off from the COVID ward and focus or concentrate on just people with disabilities and treating them over the course of the past 1.5 years. So I have tried to devote that time as much as possible to focusing more on contributing to research as a young healthcare worker. I have 5 publications that specifically relate to COVID-19. And since, as I mentioned in the beginning, that I am a neurorehabilitational professional, so 2 of them have been part of the UK, the United Kingdom COVID Neuro Collaboration, which has focused on doing systematic reviews to understand all the evidence that is out there to talk about the neurological and the neuropsychiatric symptoms or effects of COVID-19. So this, especially the one that has recently been published in the BMJ Journal of Neurology, has been one of the most widely circulated papers and the most widely cited papers on altmetric ever. So that has gained a lot of traction, and that has really made me realize the potential of working, especially in research through collaborative efforts across countries, across continents, and the importance of being involved with research as a young healthcare worker. Specific to India, in general, research for medical students or healthcare students is not given a full priority or is not considered as a priority. And because I belong to a tertiary care hospital that is very research heavy and research focused, I have had several opportunities to continue or pursue research interests of mine. However, I cannot say that for various other undergraduate counterparts from different parts of the country. And so I feel, and I can understand that they are missing out on the opportunity to contribute to research, whereas there are the ones that are working on the front lines and toiling day and night. So research is extremely important, and as I mentioned, cross collaborative and across countries or continents or different working groups, it's very important to do research. I think for people, for young healthcare workers specifically working on the front lines, the major challenges have been the impact of the pandemic on them, especially on their mental and physical health. And so that has been a really challenging thing for young healthcare workers to get past. I think the community can be more supportive by, let's say, if you have a healthcare worker in your family, in your friend circle, in your vicinity, or that you're aware of, checking up on them, calling them, just messaging them, or whatever way that you feel comfortable to reach out to them, just reaching out to them, checking up on them, and ensuring that we as citizens of global citizens or as national citizens of whatever country that we belong to follow the safety protocol that has been told to us or has been guided to us by the governments of our respective countries, because it is all evidence-based. The other thing is to stop the spread of misinformation. So, and I have been doing, so one of my research publications has been to analyze the extent of rampant misinformation. So we're all aware that, you know, misinformation related to COVID on different social media platforms has been rampantly circulated, and a lot of it has been engaged in and acknowledged by the community. The misinformation that has been spread regarding vaccines, regarding different treatments available, regarding things like plasma therapy. There are a lot of misinformation aspects that have been spread. And so one of the research papers that I collaborated on is available on the preprint server for the Journal of Medical Internet Research. And I did that as a collaborative research work with Healthcare Information for All, which works towards stopping the spread of misinformation or making healthcare information accessible to all. And so we realized that a lot of this misinformation was spreading on social media platforms, and it was also being spread by people that were looked up to as religious or community leaders, or as people from that are governing local or national level bodies. And so that was really surprising because our leaders were kind of misleading us as well. A lot of leaders tend to be or had a tendency to spread misinformation. And because people look up to their leaders or their community guiders, the information that was told to them was rampantly spread out, and it was believed very blatantly and blindly, simply because of the psychology that works when somebody that you trust or you look up to tells you how it works, or whether it does work or it doesn't work. So I think a lot of this can be taken care of by the community or handled at the community level in support of healthcare workers. And the spread of misinformation is one of them, because the more misinformation that spreads about coronavirus or COVID-19 being something that is made up. There was a lot of misinformation that spread in the beginning or the initial phase of the pandemic globally, and that led to a lot of disbelief and disregard from the community towards healthcare workers and healthcare systems in general. And so that created a lot of pressure on the healthcare workforce. Secondly, towards the second wave that hit India recently, one of the major challenges with regards to research was the rigorousness of research, as well as the time that it takes to go through the whole peer review process and to come up with results that are trustworthy, and to come up with clinical trials that are, that can be focused on. And so I feel that as a young healthcare worker, that can also increase the reluctance of several healthcare workers around the globe working effortlessly towards helping with the pandemic, about how rigorous research standards are. And this is something that is a larger systemic problem that has to be taken up in the world of research or academic, medical academic sciences. So yeah, I think I will stop there.
Thank you, Stuti. Yes, it is good to hear that research can support the pandemic, but there are, as we all know, several areas to still focus on and to improve, most certainly. Also, with the huge amount of COVID-related research that has emerged compared to non-pandemic times or previous times, this is definitely an issue to discuss further and focus on looking into the future. So, Pilar and Estefania, when we reflect upon today's theme of engaging the community and patients to support health and care workers, what do you believe could be some good ways and opportunities for patients to support health workers? Do you think that patients have a role to play in ensuring the health and sustainability of their care providers? Yes, perhaps Pilar, could you start?
Yeah, thank you. Okay, well, first of all, I would like to mention that in addition to having myself type 1 diabetes for 18 years now, also my father and my mother are doctors. So I have both experiences from the perspective of the user of these medical services, and from my parents of those who provide those services. So I'd like to mention that I remember my parents when I was younger, mentioning then that sometimes the people they treated many times expected them to do almost miracles in order to change the situation that affect them, and got angry if they couldn't help them, or also that they would get impatient if my parents had to tell them something that they didn't like at all, or even that they had to make consultations at any time of the day without a reason, important reason to make that call at 3 a.m. in the morning. So one thing I consider important to bear in mind from our side as patients is to be respectful in the way we express ourselves to our healthcare professionals. We just as we want doctors to treat us with respect as people living with a condition and take our views into account, we should also be respectful of what the doctor tells us and commit to take the best possible care of ourselves. Many times the medical care situation here in Argentina is very deficient, and the doctor is the one who has to stand up for the entire system. So we should also understand that the people where doctors are is often very uncomfortable. So with these elements in mind, I believe that some of the best ways that we can and opportunities that as patients we can have to support health workers can be to assume a real engagement in being cooperative and do everything in our power to stay healthy. The doctor can show us the way to go or give us directions on our way, but without a doubt, it is us as people living with health condition who must take the lead and trace our path. And be aware also of our care with the help, of course, of the healthcare professionals, and understand that they are persons with feelings and responsibilities outside work, just as we are. And at the same time, I believe that from the community, we can also help by providing education and awareness in order to reinforce and complement the work of doctors and health professionals in caring for our health in general, and in particular at this time, as Stuti mentioned on COVID, to share messages regarding the importance of the prevention of the contagion of COVID-19. That's becoming amplifier of the message of care in this whole situation.
For my part, I would like to add that we have always known that healthcare professionals and all those who are part of the health system are fundamental, not only to keep us alive, but so that society can basically function. And with the appearance of the pandemic, this came to light much more and made us understand that in the face of a situation as extreme as COVID-19 was and continues to be now in Argentina, the health professionals are the ones who are still in the trench. They are the ones who do not rest. They are the ones who do not sleep. They are the ones who leave their lives aside to take care of our lives. And I think that recognizing this is the first thing we must do as a society. In Argentina, we had a few months in which every day at 9 p.m. the doctors were applauded. And I thought, what is the point of that applause if afterwards we misuse the face mask, or when they ask us to stay at home, we meet with a group of people? Well, the recognition for the health professionals and all those who make up the health system, it cannot be a simple applause. It has to be much more. And now, answering your question, normally we talk about the doctor-patient relationship. And when we talk about this, the doctor is always put under the magnifying glass to evaluate if the doctor treats the patient well, if the doctor accompanies, if the doctor whatever. So I wonder, why don't we start to evaluate this doctor-patient relationship made up by two parts? And why don't we ask ourselves what is it up to us to do as patients? Perhaps, for example, remind our doctor about the study that we have to do for the age of our diabetes, for example, or remind our doctor to write a prescription for the flu shot. Why as a patient, we don't also try to facilitate the work of the doctor as much as we can? That is a two-way relationship. So let's assume an active role also from our part, and not always to be the one who expects something from them, because healthcare professionals are also people who deserve the greatest of our respect, as well as the greatest possible collaboration, so that the consultation in which we meet them is as productive as possible, so we can work together and make it productive, both of us.
Thank you very much, Estefania and Pilar, for the beautiful words, actually. Um, Productivity, constructiveness, and collaboration are definitely keywords to take away from here. Carl, as we briefly discussed previously, you had the insider perspective into how health workers manage very complex situations, working long days, saving lives. But what do you believe with this knowledge that you have gained, with what you have seen, with what you have actually put together into a documentary, several documentaries? What do health workers need most when we talk about support from patients, but also support from the media?
I think what this series achieved in Germany is that it did show it did show the different aspects of the realities of health workers, and for me it was even surprising the whole complexity to it. I mean, I think there are different levels. It's technically very challenging. Intensive care medicine is technically very challenging. I think the COVID patients especially were medically also very challenging, because at a certain stage it was very unpredictable what turns they would take, and you had problems with blood clotting and problems here and there. So it was like a multifaceted picture they had to deal with. But for me, and that I try to communicate to the public, I think a fundamental insight for me was, as a caregiver and as a doctor, you're not only doing a job, you're dealing with patients. And in that circumstance, you're dealing with patients who are often closer to death than they are to life. So I haven't seen really a single, in that ICU, I haven't seen a single caregiver, nurse, or doctor who was unemotional and unempathetic. And for me, empathy, when I saw it, that empathy was always true and it was real. But I always thought there's only so much you can give, you know. It's like at some point I felt like the people were already drained, but they still gave their care and respect and took the time. For example, when patient died and there weren't any relatives, the doctors and nurses spent the last minutes, often like 20 minutes, half an hour with the patient. Also, they had a very high workload, communicated with the relatives via the phone. Then this was an ICU where you had patients coming in under reanimation, also being put on ECMOs. Most of them didn't survive, but these were patients which were coming into the daily routine, and the doctors had to, attend to them in a very high pressure environment, where the clock was really ticking in the background. And then another patient died, and you had to inform the relatives, and this was just something that came in every day, disrupting the normal day-to-day care giving for the ECMO patients. So I think I felt that there was a huge need for the doctors and nurses to communicate to the outside the emotional aspect of it, and how emotionally draining it is. And not so much, I think there are two topics. It's the emotional aspect, and it's the workload. The workload was immense. There was no time to stop and to fill up your batteries, and or to process what you had experienced there every day. And still you had to go in, and we didn't know whether the third wave was coming. Nobody knew when it ends, and the patients were flooding in and dying and so on. So it was the workload, and it was to give the people an idea really how emotional draining it is. And for the public, I think the public was not prepared to that level of uh, emotion. Yeah, and that what made that series, that's why it had such a huge impact. And I know that as a filmmaker, because when you have emotion, people cannot stop, they're hooked to it. But I think they were also shocked to see the level of what you're confronted with as a doctor and as a caretaker, and on the other side, how much they were still able to give. And it's not that you have your stereotypical cynical doctor, just brushing it away. They still gave a lot, and I think that was a very, very central aspect. And when I think back in the beginning, I mean, they gave me all the trust. They said you can film everything. Nobody hid anything from me. I mean, there were tears. We talked about the most intimate things, and everybody said to me always, please, Carl, show it as it is. And in the beginning, I didn't know what they mean, show it as it is. But it wasn't meant like show it as it is, how bloody it is sometimes, and how crazy it is. I think show it as it is, how emotionally demanding that work is. And for me, that was then the most important message I wanted to get out. And I think here in Germany, at least, the general public really for the first time saw that intensity, that emotional intensity, and how to deal with it. And that shocked a lot of people. And I got lots and lots of feedback and emails, and my broadcaster also. And basically, to sum it up, of these hundreds of emails and comments, actually thousands, also on Twitter and so on, it was always just thank you. It was just thank you. And as Stefania said before, the people were clapping from the balconies, and the doctor said as well, yeah, well, it doesn't really help us. Well, it's true, but I also think that in Germany, people kind of were aware that something is happening inside the hospitals and inside the ICUs. They didn't really have an idea, because I also think in that circumstance, images and a documentary really help, because it's very, very hard to put in words. You really need to see and feel what's going on. And once they saw it, they just wanted to say thank you. That was all. They wanted to say thank you. And when I transmitted all of that back to the doctors and nurses there, I think for them it was good as well, because yes, it was a recognition for their work, and they want certain specific things. Sometimes it's about better pay. I think generally it's about less workload. But also it's just that certain recognition and that thank you. And I think in the German public, there was a lot of readiness to give that thank you, and people felt a little bit helpless. They wanted to do something, and I always say, if you say thank you, it's enough. You can't do more. But if you say that, then I'm happy to pass it on. So that was a little bit what happened there, and what I tried to transmit to the public in Germany.
Thank you, Carl. This is very interesting to hear and understand as well. Pilar, a question to you. So, looking into the future and thinking from the perspective of patients with chronic illnesses, could health workers maybe provide better support to chronically ill patients when we talk about future emergencies? And also from the other perspective, how could NGOs similar to Cuidar also support health workers?
Okay, great. Well, in the case of future pandemics or global health crisis situations, I believe it's essential that medical care and attention for those of us who live with NCDs, for example, that attention should be maintained as a priority, because no critical situation stops this condition, these health conditions, and we continue to live with them at all the time, 24/7. So I think that this is very important to take into account. As we say in Cuidar, no pandemic can limit the access to insulin, for example. And truly, what has happened with COVID-19, at least here in Argentina, was extremely, it was exasperating. It was desperate for people, and really sad at the same time, because many people couldn't get in contact with their doctors, or they did not receive the insulin or the necessary medication for taking care of their conditions. And there was even cases of people living with cancer and with cancer treatments that had their treatments interrupted, and that implied that the disease was significant, could have significantly advanced. So also, on the other hand, I think that in the case, for example, of diabetes or self-screening, education is of fundamental importance, because we as patients, we can take care of ourselves without depending all the time on doctors. So I think we as patients, we should try to be the most self-sufficient as we can in order to take better care of ourselves without always depending on our healthcare team. And so I think it's really important to help educate patients as much as possible, so that we are not so dependent on our doctors, and we can handle ourselves and our self-care as autonomously as possible in this, especially in this context of crisis. Because, for example, if there's phase 1 situation now in COVID-19, and we can't go anywhere, we need to be we need to be able to take care of ourselves without maybe having access to the medical consultation. And maybe regarding how we can, as from NGOs, as similar to Cuidar, we can support health workers. I'd like to mention that at Cuidar, we do many activities precisely focused on education of people with diabetes, for example, with nutritionists, cardiologists, infectologists, or psychologists also, in order to provide people with tools that help them take better care of themselves. And with the COVID outbreak, we also made a special focus on the messages that we shared through our channels, our social media channels, so Twitter, Facebook, and Instagram at Cuidar Diabetes. And we also created a web page, especially on COVID-19 and diabetes, to provide quality of reliable information and quality information in order to just amplify the arrival of the messages of the health systems to society, and thus reinforce the community work in all this emergency situation, no? And especially focused in preventing the contagion. So I believe that as NGOs, we can be of great help to support health workers by using our social media and communication channels to deliver the message that need to be delivered to patients and the whole community. Undoubtedly, health workers are very, very important to the life of each person and to society as a whole. So it's important to take in mind that health workers are always there to help us when we are in pain, maybe when one of our loved one had an accident, or at night, on weekends, when it's a holiday, and now especially during the COVID pandemic. So their care allows us to stay healthy. So I'd like to say that let us be there for those who always take care of us, and taking care of ourselves will be taking care of them too. So thank you.
Thank you, Pilar. So we are reaching the end of our webinar. I have a question to Stuti, and there is also one question I see in the Q&A section regarding preparation for future pandemics. I believe that several of our speakers have already covered this topic as well. So perhaps also for Stuti then. Firstly, what do you believe are key takeaways that health workers, young health workers especially, have learned from this pandemic? And looking into the future, and how can we be more prepared? And also, what kind of support do health workers need most?
So I think that's a very important question, and I think I would like to answer that from the Indian perspective first, and then maybe go on to a global perspective. So I think healthcare workers have definitely learned the importance of time management, multitasking, and emotional resilience, as well as physical health. And we have really understood the importance of uh, the major role that people in the community have to play in terms of upholding the healthcare system. So in India, when the second wave started, there was a complete breakdown and collapse of services. There were people that were coming out, common people that were coming out to help. If you saw Twitter or the social media, we were collectively going through as a whole community, not just as healthcare workers. I think during the first wave, it was the healthcare workers, but during the second wave, we were collectively as a nation going through so much of trauma that we were, when the moment we opened our social media handles or channels, all we saw were requests of people dying and not having oxygen, and requests of oxygen cylinders, requests for ICU beds. And it was an overall extremely depressing phase that we all went through together as a nation as a whole. And it was even more depressing for it was so traumatic, and it was very challenging for frontline workers, healthcare workers, not just healthcare workers, but also people, all types of essential workers that were on the front lines of battling the COVID-19 pandemic, especially during the second wave. The second, I think, most important takeaway is to realize that we need more healthcare workers. If you see in India, because it's such a populated country, there's almost one doctor per 10,000 population, and 1 to 2 or 2 to 3 doctors per 10,000 population, and the same goes for nurses as well. And then there's even lesser therapists and other specialized professionals for 10 per 10,000 population. So I think it made us realize the importance of training more people to come into the healthcare profession, increasing the number of opportunities or the number of academic places that are there in institutions across the country to train more people to become healthcare professionals and take up different professions in the healthcare sciences and even clinical work. And it also made us realize the importance of research, like I also already mentioned, the importance of doing rigorous research and the importance of communicating this research properly, interpreting it properly, and understanding it properly, and communicating it properly. Because we as healthcare workers, it is definitely our responsibility, as well as the community's responsibility, to ensure that the correct information is passed on from within the healthcare system to the community. I think the another important key takeaway was that there was a complete breakdown of the roles that healthcare workers are supposed to do. So we were taking up administrative roles, not just healthcare workers, not just doctors and nurses, but all different healthcare workers were taking up administrative roles to distribute oxygen cylinders. They had to make really critical decisions to whom should the ventilator be provided, whom should the oxygen cylinders be provided, whose life is more at stake when everybody's life was at stake. So to take those to one patient over the other, or to one person suffering from a critical illness over the other, it was completely against what we have been taught throughout our education as caregivers, which is to put the patient and the patient's needs first. And that was not possible to do because there was a complete breakdown of the roles of healthcare professionals and the healthcare system in general in the crisis situation that hit India during the second wave. So doctors and nurses and other healthcare professionals in the ICUs, but they also had to take care of provisions. They had to take care of administrative roles, which are things that we have not been trained for, and these are things that had to be learned during crisis, a time of crisis, and a time of panic. And so I think that is very, very has been challenging. And the other thing I think is more towards the context of, I would say, a global context, is the importance of healthcare workers, the importance of mental health of healthcare workers. I still have a lot of my colleagues
Tuti, I believe it might be a bit of an internet connection. Okay, so until Stuti is back, I see Wakari Bandi, you have your hand up. do you have a question you would like to ask? Bakari, please. Hi, Bakari. Hello.
Yeah, I hope you are getting me.
Yes.
No, you are getting me.
Yes. Would you like to ask a question?
Well, just a contribution to the engagement about communities to support the healthcare workers. You know, I'm really from Sierra Leone. For the past 1 month now, we have been having high in cases reporting on a daily basis. Before now, we have been reporting like 1 to 5 on a daily basis, but now we are reporting up to like 100 or 120 cases per day. And because we have engaged the community, because most of our health facilities are now full with cases, so it's important we have to engage the communities as to how they should take care of the home care cases, because if we could not do that, we could not break the barrier or the chain of transmissions, because they have to know first the importance as to where we should care for those who are asymptomatic cases at home. Then by so doing, we will help break the chain, because likely there will come a time as have homes to keep those cases, or even to, if we could not engage them now and tell them the importance of why they should take care of them, then we'll be missing it all over again.
Thank you, Bakari. Thank you very, very much. This is a very, thank you. This is a very important point, I believe, that you mentioned regarding home care as well, that patients need to be trained to provide care to their loved ones, and to also know not to share misinformation, but also to keep distance and keep all of the provisions needed to support and to save their loved ones. Perfect. Thank you very, very much.
Of course. If that is being achieved, we change the health facility.
Yes, perfect. Thank you. Thank you, Bakari. A very huge thank you to all the speakers as well, and to all the attendees for the very interesting discussion, honestly. And to all of you who attended today's webinar, please do share your thoughts with us. Share the recording of the webinar. Follow us on Twitter, Facebook, YouTube, and please join our events celebrating and the year of the health and care worker. So all the best to everybody, and thank you very much.
I will put up the link for the documentary series. I emailed with my producer. It's geo-blocked, but they will unblock it, maybe take a day or so, and then we can provide it. The English subtitles there. Yeah.
Wonderful. Thank you, Carl. We will be sharing the documentary as well with all of you. Wonderful. Thanks so much. Bye, everyone. Stay safe.
Okay. Bye-bye.
Thank you.
Bye-bye.
Bye.